Welcome everyone. So today we'll see therapeutic nurse-patient relationship. Relationship. So it is the state of affinity between two individuals. Affinity means connection. So it is a connection between two individuals. So this relationship, it is of three types. So first one is social relationship, intimate relationship, and therapeutic relationship. So this social relationship is there, no? It occurs for the purpose of friendship, socialization, or enjoyment. And this intimate relationship, it occurs between two individuals who is having an emotional commitment with each other or who shares emotional connection with each other. Next one is therapeutic relationship. So this therapeutic relationship, it will occur between the nurse and patient to meet the therapeutic needs or for the therapeutic purposes. Next is nurse patient relationship. Nurse patient relationship in which the nurse and patient work together towards the goal of assisting the patient to regain the inner resources to meet life challenges and facilitate growth. So this nurse patient relationship is there, no? In this, nurse and patient, they will work together to achieve the goal, and they will use various resources, they will face various life challenges, and they will facilitate the growth. So next is components of therapeutic nurse patient relationship. So four components are there. So first one is rapport, second one is empathy, third one is warmth, fourth one is genuineness. So this rapport is there, no? It is a relationship or communication which is especially harmonious and which is useful also, and it is very important for nurse patient relationship. Then this empathy is there, no? It is ability to feel other person's feelings, that is empathy. Then this warmth, it is the ability to help the patient to feel cared and comfortable, that is warmth. And genuineness, it involves being one's own self, that is genuineness, like being a genuine person to the patient, that is genuineness. Next is phases and task of therapeutic relationship. So first one is pre-interaction phase. So this phase, no, it will begins when the nurse will be assigned with the patient. Like in this phase, the nurse has not met the patient. Now she will plan for the meeting. She will do the planning for the first interaction with the patient in this phase. So what the nurse's task will say, so she will explore her own feelings, fantasies, the fear which will be in her. Then she will analyze the professional strength and what are the limitations. She will analyze them. Then she will collect data about the client. Then she will plan the first meeting with the patient. Next, what the problems encounter means, there will be difficulty in self analyzing and self acceptance. Then there will be anxiety, then anger about herself, and depression also can be there. So these are the problems. Okay, next is introductory, that second phase, that is introductory or orientation phase. So during this phase, this nurse and this patient will be there, no? They will meet for the first time. So your rapport will be established, trust will be there, and acceptance will be occur. Like the patient will be there, no? He will accept, and the nurse will accept the patient, and the patient will accept the nurse. Then establish communication. So your communication will occur then, like why by verbal expressions, then thoughts and feelings. Then your data will be gathered, then including like patient's weakness also will be identified, as well as patient's strength also will be identified. Then your patient's problem will be defined, and your priorities will be set for nursing interventions, and even the goals will be planned. So next is problem encounter. So the major problem encountered during this phase is related to manner in which nurse and patient perceive each other. So this phase problem is like when the nurse will meet the patient. So the thing which is a problem is that they should not they will perceive each other's, they should understand each other. If they perceive each other in different way, then that will be a problem here. So next is working phase, that is third phase, that is working phase. So most of the therapeutic work is carried out during this working phase. So all the therapeutic work will be there. It will be done during this phase. Your nurse will see patient's anxiety, then she will see how is the coping mechanism and all independence. Then the nurse here, she will gather data, then provide him opportunities for independent functioning. Like he she will provide some opportunities for independent functioning. Then she will evaluate problems, and even she will set goals and she will work on the goals. The problems encounter, okay. So testing of the nurse by patient, so the patients will test the nurse. Then progress of the patient, so nurse will see whether the patient has progress or not. The nurse fear of closeness, so the nurse will get fear of being close to the persons or being attached to the person. So then life stresses of the nurse, so various workload of the nurse. Then resistant behavior, if the patient is there and he is not accepting or he is not doing what the nurse is saying, then that is resistant behavior, like not resisting, like I will not do this, like that kind of behavior. So fourth phase is termination phase. So this is the most difficult but the most important phase of therapeutic nurse patient relationship. So this phase is important also and most important also. Like of therapeutic nurse patient relationship, it is the most important and most difficult phase, because here the therapeutic nurse patient relationship is there, no, it will come to an end. So here the nurse will establish reality of separation, so she will make the patient understand the reality of the separation, then she will make herself also. Then your mutual feelings will be there, no, that will be explored, like of rejection, loss, sadness, anger related behavior that will be expressed over here. Then formulated plan for meeting future therapy needs, so the plans will be planned for meeting in the future, like what future therapy will be done to the patients and when they will meet, that all will be formulated. So next is problem encounter. So your patients may perceive termination as desertion and may demonstrate anger behavior. So the patients will pursue may pursue these terminations, and like the patient can show this anger behavior also, and in sometimes the patient will be there, no, they will like punish the nurse by not talking to them or ignoring them during the last few interaction. Then fault finding also will be there. Next, patient may be depressed also, like patient will be depressed because of this thing. And this fault finding is there, no, it is kind of another behavior here. He may refuse to follow through on something that has to be agreed upon before. So if anything is there means, like patients will be there, no, it is a therapy which is not beneficial or not working, like he will tell there's some therapies that it is not working, like simply saying that, so that he may stay there again. Then patients may be depressed, I said maybe he can be depressed because of this all thing. Then flight of illness, so the some patient will experience some symptoms by hearing this, like there will be termination of this nurse patient relationship, that is flight to illness. So thank you everyone, with this we'll end our video.